Good afternoon, fellow Guyanese viewers. This afternoon, I just want to use some time to address a few issues, given the fact that we have just completed the presentation and approval of Budget 2025. And as I said before the budget, a strong focus in the 2025 budget will be on community investment, community infrastructure, and fostering the development and advancement of communities, whilst at the same time addressing community challenges and different areas of community development. After more than a year of consultations among communities all across the country, there is a high degree of satisfaction with the macro infrastructure, the roads at the community level also, the expansion of drainage networks, and the general investment in healthcare and education. However, we and the communities all across the country, are aware that there are some essential issues within communities, within NDCs, within municipalities and towns that we must address. And Budget 2025 sought to make direct intervention and allocations to address those issues, whether it's security, sanitation, drainage, environmental issues, and I want to go through some of that and to show you how Budget 2025 would address those issues. Also, the healthcare system, the work that we're doing in healthcare, some of what you can expect, some of the expansion of some of the programs that we already have in existence. I want to talk a bit about that. I want to talk also a bit about, of course, our whole infrastructure supporting community grounds, improving sport facilities and so on within the different regions and community, and also to address some other issues that I think are important for us to have the right perspective and to have the facts before us. But it's interesting for us to commence this discourse by understanding a bit about what is happening globally also. And how do we prepare to meet some of these global challenges and to ensure that we mitigate as far as possible the consequences of these global challenges. And one of the global challenges that I want to focus on today is that of food production. As you know, the world in the last 3 to 6 months has undergone serious challenges in terms of environment, natural resources, and even the ability to produce and to keep a pace with global food demand. But particularly, the sector that is undergoing tremendous difficulty globally now is that of poultry. And it's important for us to understand what is happening in the poultry sector because, as you know, we have had massive growth in the demand for poultry products in Guyana, from hatching eggs to table eggs to meat, and we have also had tremendous growth in terms of local production. But when you look at the pace of growth in the national demand for these products, you will see that on the supply side, we have some challenge that we will have to mitigate against. And one of the major challenges facing the industry globally today is that of the bird flu. Commonly, that is what is known as the bird flu. And why is this impactful for us? Why should we understand the implications of this for our local market and for Guyana itself? As you're aware, we import more than 52 million hatching eggs. This year we'll need a bit more. And almost all of that hatching eggs comes from the US. Now, most of the hatching eggs, if not all, comes from Georgia, Miami area. Those are areas not affected as yet by the bird flu. But we have massive problems in the rest of the US, where some estimate put production of hatching egg down by 40%. We have had instances where the entire production system had to be removed so that they can mitigate against the widespread of bird flu. So when you have a situation where in the US, which is a major player in the market, which is a major player in the poultry market, having such a big impact, then of course the demand in the US has to be satisfied from areas like Georgia, like Miami, that does not have an impact as yet. And of course this will have an impact on the global supply chain. And Guyana, of course, is part of that global supply chain. So that is from a hatching egg perspective. When you look at the production globally, that is meat production, some estimate has the production declining by as much as 33%. And this is taking into consideration a very important fact. The second highest producer of meat and eggs on the market, which is Brazil. US and Brazil controls most of the global market. Brazil is not affected by bird flu. So if Brazil gets affected, then we will have major disruption in the global poultry market, and we have to plan against this. We have to plan and mitigate against these circumstances. Fortunately for us, our annual table eggs, which is about 5.5 million eggs annually, we have been able to produce that more or less locally. Because this is another area that is severely affected on the global market. And these effects, of course, would lead to price escalation, and for many countries, imported inflation. So what are we doing in Guyana as we mitigate against this? As you know, we are trying to ramp up our production of broiler meat. The demand is projected to increase tremendously this year. So we are trying to support the local farmers, support the local industry to ramp up production. Hatching eggs, we never produce hatching eggs in Guyana. Last year, however, we were able to produce 1 million hatching eggs in the pilot program. And we are looking to see how within 3 years, in about 3 to 4 years, we can be self-sufficient in the production of hatching eggs. So this year, we'll have heavy investment and support to the private sector consortium in building out the industry so that we can increase more of the hatching eggs that we produce locally. So the Ministry of Agriculture is having what we call an actionable task force that is tasked with liaising on with the World Animal Health Organization and the US. For a matter of fact, there are daily meetings that we are having to ensure that we are kept abreast with what is happening in relation to the bird flu scenario and how we can continue to implement measures which include stronger monitoring of our port of entry, stronger monitoring of at-risk border areas. We are using drones and other forms of technology to help us in the monitoring, and we are part of the global information sharing network that would allow us not only to generate information, but to proactively and aggressively address these issues. Because as you would appreciate, this can have severe implications in terms of our supply chain, especially if Brazil gets affected. So it's very important also for us to work closely with Brazil to ensure that their production system is insulated and secured against this bird flu scenario that we are faced with. So this is an important global situation that we are faced with, and we are looking at mitigating or reducing the effect of this challenge globally. So that is one of the first update I wanted to bring to you. Secondly, in healthcare. Now, I want us to have an appreciation for what we are looking to achieve in the healthcare sector. We want to, as we have said in the manifesto, develop a healthcare system that is second to none, a healthcare system that is world class. And that healthcare system is not only about the public healthcare system, it is how we integrate the private healthcare system. How do we ensure not only do we incentivize, which we have done already, private healthcare, but how do we integrate the management of public and private healthcare? How do we have developed a shared platform for human capacity and capability, but also a shared platform through which our national health strategy, which is aimed at giving every citizen a basic equitable level of health care, how is it implemented across the board? Now, we are having discussions, for example, with Northwell as to how we can develop another information sharing platform, which is part of the health information system, but a human resource and specialty platform in which we can have all the specialists in our healthcare system and also specialists in the Northwell healthcare system, how we can have a platform in which our local doctors and doctors within the public healthcare and private healthcare system can have a reference ability, how they can have a system in which these specialists can help, and it's already occurring through telemedicine and through e-medicine, how they can be a part of the infrastructure that support the healthcare system here. So that is something that we are working aggressively on. We are working with Hess Corporation also on the expansion of the agreement we have with Mount Sinai, who is powering our healthcare system. And there are a number of important issues that we are advancing in terms of healthcare. So let us look at some of what is ongoing and some of what we are pursuing in the immediate future. As you're aware, we have 12 new regional hospitals that are under construction, and this is an important aspect to ensure that we have a healthcare system that is equitable and give basic equitable access across the different regions of our country. So we have 12 new hospitals under construction, 12 new regional facilities under construction. Outside of those 12 facilities, in the last 4 years, we have completely rehabilitated. We have built, not rehabilitated, we built 25 new health centers. We have also worked on the digitization of our healthcare system. And in the digitizing of our healthcare system, we have the telemedicine, 84 sites, medical sites, especially in the hinterland, are already connected to telemedicine. We have the electronic health record system that will commence very soon, the patient management information system. And this is both for the public and private healthcare system. Now, an important aspect of the healthcare system, the telemedicine aspect of the healthcare system, is integrating our telemedicine services with world-class facilities, whether with Mount Sinai, Northwell, or with major facilities in India, so that we understand the constraint of the limited human resource assets and areas of specialization. That is why we are partnering with the best, so that our telemedicine program can be a global telemedicine program that fits into leading health institutions like Mount Sinai, Northwell, and other institutions in India. And that has already started. We understand also that the national emergency healthcare system, that we have to invest in this. So very soon we're going to put together a team to look at ways in which we can enhance emergency healthcare. You know, right now you go to Georgetown Hospital and other hospitals for emergency healthcare. So we are working now on looking at a scalable model, a world-class scalable model, emergency healthcare system. And we have had discussions with Northwell, for example, as to a scalable model that is applicable to Guyana, in which we can have emergency healthcare and diagnostic center in every single region, supporting the regional hospital and delivering these very essential and key services. Now, the diagnostic centers, because healthcare and public health relies heavily on diagnostic facility. And the diagnostic centers that we are building across the country would have ultrasound facility, X-ray facility, CT scan facility, MRI facility, and now mammography machines are being installed. These are important facilities in the public healthcare system, but also invested in by the private healthcare that would give us that world-class healthcare system that we are building. The great news is that with Mount Sinai, we are now looking at the building of our Forest Oncology Center. And the center would not only be doing screening, we are looking to invest, of course, in chemo and radiotherapy to support cancer patients. Now we have to send these patients out of Guyana, very expensive. So the Oncology Center will be a world-class center that we're doing in conjunction with Mount Sinai, because as you're aware, these centers have to be managed. So in the initial years, there's the maternal hospital also, these regional hospitals. We are looking at how we can complement our local expertise with international expertise in the initial years, whilst we are training our local expertise and our local human resources to take over fully. So we are fully aware that we have to get the management structure, the health administration structure. We have to get support in specialty areas to help us in the management of these health facilities in the initial years as we build out the facilities and so on. But we are also not waiting for these facilities to be completed. For example, we have trained more than 3,707 young Guyanese in the healthcare system, whether it's healthcare administration, public health, nurses. 3,290 persons are currently in training. And these include nursing assistants, nurses, medics, lab technicians, pharmacy assistants. We have also, to support the expansion in the healthcare system, we have built 2 new nursing schools. In Essequibo, we have the nursing school scheduled to be completed in the last quarter of this year. We have the New Amsterdam Nursing School, which is scheduled to be completed also in the last quarter of this year. So we are also working with international partners to see how we can recruit nurses, medical technicians, lab technicians, how we can recruit specialized doctors, so that these facilities, when they are completed, we will have the right human resource complement to support the world-class service that the facilities would deliver. A very important aspect of the work that we're doing also include facilities like a rehab center. As you know, a lot of our persons are affected by stroke, and we don't have a modern rehab center. So this year we're going to commence the building of a rehab center that would look at comprehensive rehabilitation in different areas. And I give the example of stroke. Among men, one of the highest contributor to cancer is the prostate cancer. And then we have the issue of breast cancer among women and cervical cancer. We have started the program of screening for cervical cancer. We have enough data set now to inform public expenditure around that. This year, last year I know we have had 13,000 PSAs for prostate cancer. We want to expand that program. So the universal health care voucher would address this issue. So we can know the scale of the issues we have in the top 2 most prevalent cancers in Guyana, and we can align our public expenditure against those priority areas when it comes to cancer diagnostics and treatment. Because we don't only want to diagnose, we are investing in the facilities to do the treatment. So that is where our focus is on. Not only the investing in the regional facilities, but also in these specialized areas that are critical to the needs of our population. Now, to support our efforts in terms of breast cancer, for example, we have 4 new mammography machines that will be that are installed at Linden, New Amsterdam, Saudi, and Letem. So you can see these facilities are not centralized. It has been decentralized all across the region. Cervical cancer, we have the HPV vaccine, which is free of cost. And recently I've had great discussions with healthcare professionals and researchers, and they've attested to the importance of this HPV vaccine in preventing cancers. 12,000 women between the ages of 21 and 65 would have already done the test of the tested persons, and this is why the test is so important. Of the tested persons for cervical cancer, the program we launched last year, we had 17% positive ratio. 17% of those tested. Now, this is a cancer that can be prevented. This is a cancer that can be treated with early detection. And that is what we have done. We have invested and given every woman the opportunity to have early detection and to have the vaccine to prevent the cancer. There are very few countries that would have taken this proactive approach to dealing with cervical cancer. Those women who were tested positive, we were able to intervene and invest to ensure that they have the treatment that is required. Now, when you look at men, cancer among men, in 2024, we did 13,688 prostate-specific antigen tests, which is PSA. Now, this is important for men. Out of those tests, which is a small number in terms of our population size, 19% were elevated. 19% were elevated. Of those men with elevated PSA, because the test allows us to understand those who have elevated PSA. Out of those men with elevated PSA, we did 536 biopsies, of which 38% were positive. Now, that's a very high ratio. But we could not have achieved any of this data if we did not invest in the screening process, if we did not invest in the facility. And this is why I want to encourage men and women to utilize the facility, because we can treat these things. These things are treatable with early detection. And it also reduces public health expenditure in the long term if we can detect early, if we can avoid. So we are working now to have a national program with Mount Sinai, because the technology is also advancing, where we can roll out this, and other tests that are applicable, that are high risk and applicable to us on a national scale, so that our public health expenditure now and in the future can be properly aligned to these statistics that I've just given. importantly also, is that this now allows us to align our public health education program, but none of this would have been possible without the investment that we are making in healthcare, without the investment that we are making in the expansion of health services. These are the results of a healthcare system that is delivering a world-class healthcare system that is not only looking at diagnostics, but is looking at treatment, prevention, because we want a healthy population. Now, when you look at the patient assistance program, and we can only assist you if you're part of the program. We had in 2019, 684 patients would have benefited. In 2024, from 2019, only 684 patients. In 2024, an increase of over 700% across the board to almost 3,000 patients. Almost 3,000 patients, all benefiting free of cost. Dialysis. This, under the APNU-AFC government, they had 63 persons, 64 persons, let me not rob them of the one, 64 persons who benefited from dialysis received 300,000 each. Under the PPP civic government, look at that, is 2019 figure. In 2024, we had 550 persons who would have benefited from dialysis. And dialysis is now available in region 2, 3, 4, 6, and 10. Not only more persons benefiting, not only more money going for dialysis, but the availability of the service now is not only in region 4, it is now in region 2, 3, 4, 6, and 10. And of course, we're going to continue the expansion of this service. Looking at another initiative that we launched, because it's important for us to understand the results of these initiatives. You had, in 2024, 68,320 eye tests completed. Almost 70,000 eye tests completed. And guess what? Almost 55,000 persons who had these eye tests completed were given spectacles, all free of cost. Between 2015 and 2020, 16 cataract surgeries were completed at Port Moran. They shut down the facility. Can you imagine that? Between 2015 and 2020, and these are the statistics that the APNU-AFC hides from. They can't account for their period in government. They're not transparent in accounting. The facility at Port Moran was closed down between 2015 and 2020. 16 cataract surgeries were done. From 2020 to 2024, we have done 3,665 surgery at the same hospital. We re-equipped the hospital, and we have done 3,665 of those surgeries compared to 16 between 2015 and 2020. Today, any citizen from any region who require cataract surgery, we do that free of cost at the Port Moran Hospital. Look at audiology. In 2019, the program benefited only 647 persons. And people had to pay. Under the APNU-AFC government, they had to pay $65,000 each for their hearing aid. 647 persons benefited. And they had to pay $65,000 each for the hearing aid. In the last 4 years alone, under our government, more than 4,000 persons benefited from hearing aid free of cost. They did not have to pay. Free of cost. Here is where the revenues of the country is going back to our people, going back to create world-class healthcare services, world-class education services. These are the results that they cannot accept. They cannot appreciate. So what do they go back on? Look at all the new cycle. They go back on their old strategy. accusation of corruption, accusation of perception of corruption, accusation. That is their strategy. Using race baiting, criticizing, because of the inroads we are making to, criticizing Afro-Guyanese who join us nastily. They go to their old strategy. Corruption, perception of corruption, race baiting, and recently the leader of the opposition, unable to respond factually or respond to the type of development that is taking place, goes back to his old threat of destabilizing the environment, violence, the days of slow fire, more fire. That is what they're capable. That is the only thing they're capable of. Destabilizing our society, not results, not achieving these things that we are achieving, but we can account for our period. We can speak about real results, about the investment we are making in the healthcare system, the future plans that we have for the healthcare system, and the type of results that is generating. When you look at dental services, if we look at dental services in 2022, unless there's nothing to show for their period, in 2022, we did 165,000 plus procedures. That increased to almost 387,000 procedures in 2023 and 495,000 procedures in 2024. In the last 3 years alone, more than 900,000 procedures. Actually, almost 1 million procedures when you look at the numbers. Almost 1 million dental procedures between 2022 and 2024. These are the results of our investment. We are not talking here about a second-class healthcare system. We're talking about a healthcare system that would have nodes around the country dealing with emergency services at a scalable level within regions that is integrated to a national emergency model. We're talking about rehab centers, aftercare service. We're talking about an oncology center that deals with treatment, world-class center. We are talking about diagnostic centers that are equipped with CT scans, MRIs. We're talking about a digital health model that has a world-class telemedicine service that is linked to global health service providers. We have a system that is integrated and being built around world-class systems from Northwell, Mount Sinai, and other systems out of India. We're talking about building a platform in which we integrate our capacity and capability in the private and public sector that will support the building of this modern world-class healthcare system. That is what we're talking about. And I've given you some of the results. In the last 3 years, 25 new health centers and health posts, 4 in Region 1. In Region 2, 1, we are building more in Region 2 this year, 6 in Region 4, 3 in Region 5, 3 in Region 6, 4 in Region 8, 3 in Region 9, investing in Region 10. These are the type of investments that we are making. Investments not to 2025, investment to 2028. Soon we'll be launching the new West Demerara Regional Hospital, which is expected to be completed by 2028. The Stroke Rehabilitation Center, construction will start in 2025, expected to be completed by 2027. The Oncology Center, construction will start in 2025, expected to be completed by 2027. The telemedicine sites that allows for video consultation ECG, ultrasound. These are the investments that are bearing fruit. These are the investments that is allowing us to achieve this world-class modern healthcare system. Then let us look at another area. Let us look at what we are creating in our community sports facilities and what we are able to achieve in our community sports facility. Last year, up to last year, we have completed 550 grounds across the country, 246 of which are hinterland community. We've installed lights in 75 locations, because we understand quality of life and improving the standard of living. Quality of life and improving the standard of living is key. And having facilities, recreational facilities, sport facilities, that can help us to achieve this is an important aspect of holistic national improvement. If we want to develop world-class sportsmen and women, these investments are essential because we want sports, entertainment, and culture to be an integral part of the economy and the country and the system that we're investing in and developing. This year, more than 100 lights, more than 100 grounds will benefit from the installation of lights. Lights to allow our citizens to live more productive life, our athletes to have the facilities so they can train, our communities to come together closer. More than $2 billion is set aside for the building out of grounds, the rehabilitation of grounds across the stadium, across the country. And this is outside of the 5 internationally accredited stadiums that we are building now at Anna Regina, Mackenzie, Bayrock, Palmyra, New Amsterdam. These are outside of those, in addition to the multi-purpose facility. All of these things we have delivered beyond the manifesto. And these multi-purpose facilities are going to be exactly the same and even better than the gymnasium we have in Georgetown. We had one gymnasium nationally that everyone had to come to. Today we are commencing the construction of these multi-purpose facilities across different regions. In Mabaruma in Region 1, Madhya in Region 8, Letem in Region 9, Bartik in Region 7. These facilities would allow our athletes to play futsal, badminton, table tennis, volleyball, indoor hockey, basketball. These are only some of the sporting discipline these facilities would be able to facilitate. Boxing. This is what is called equitable development. Diversification, not only from an economic level, but from a level of equity, where citizens across every region can enjoy similar type of facility, can enjoy similar opportunities, so no one is locked out of the development trust and advancement of the country. When you look at the community grounds, and you look at what took place under the APNU-AFC government, the APNU-AFC government that claims to love young people, Nigel Hughes, and all of these guys who are part of that government, walking into Lepo Street and all of these areas as if they cared. They care nothing. As if they have any concern. They have no concern. They were in government, not only in between 2015 and 2020, for 28 years before that. For 33 years they were in government. For 33 years they were in government. And what did they do in their more recent government, 2015 to 2020? They didn't care about young people. The APNU AFC cut expenditure on community enhancement by 60%. The very people who are jumping up in a frenzy. We love young people. We love Linden. We love Barbies. We love New Amsterdam. We love sports. We love our athletes. What is the fact? What is the fact? They cut expenditure on community enhancement by 60%, averaging just about $100 million per year. During the period 2011 to 2014, they like to say about oil and gas. Between 2011 and 2014, when we were in government, the average expenditure on community enhancement by the PPPC government was $300 million. They came in and found, when oil was found, and their average investment was $100 million. Our average investment before oil, 2011 to 2014, was $300 million. It's a philosophy. It's a philosophy. Has nothing to do with oil and gas. This is the reality and the facts that they want to run away from. This is what they can't take. This is what they can't get away from. So they go back to their old position. Threats, violence, racism, hate, cry of corruption. And I'll address that just now. I'll address this transparency report. When you look at our land policy, look, since we came into government, almost 21,000 acres of land was developed for housing. More than 90% of which went directly to low income, moderate income, middle income, and high income housing development for young professionals. They won't speak about that. They won't speak about that 21,000 acres of land that we've invested in with infrastructure, drainage, roads. 21,000 acres of land. That does not suit their agenda. That does not suit their agenda because their agenda is to create mischief. Their agenda is always to create division, unease within the society. So you have to be careful because what they're trying to do is to circumvent the reality and create narrative, misleading narrative, to drive interest and drive the population interest on that road. Every single block of land that went to developers, whether it's for hotel, housing development, industrial development, commercial development, goes through a process. But they're not interested in that. They're interested selfishly in the propaganda, selfishly in the misinformation, because that is what drives their interests. That is what suits their agenda. That is what massages their agenda. Let me continue to look at the same investment that we are making. When they closed Gaisuku, they also closed many community facilities in poor communities across this country. Because as you know, Gaisuku would have been maintaining grounds and sports facilities all across the country. So when they closed Gaisuku, all of those grounds that were maintained, completely lost. Since 2020, as I said, we've invested in more than 564 community grounds, 246 grounds in the hinterland, This is our track record that we are proud of. This is our track record that we are proud of. And the investment is bearing fruits. The medals secured by Guyana in its national and regional tournaments in 2023 was 167. In 2024, it was 534, an increase of 296%. That is not accidental. That is as a result of a carefully articulated vision, the implementation of a vision that brings with it results. The elite program introduced in 2024, we have an athlete stipend support program and a strong partnership with sports association. These are the things that has helped us. Today, our participation in international and regional tournaments has increased by over 100%. More than 800 athletes would have benefited from this exposure, from the investment we are making, would have been given the opportunity to participate in regional and international tournaments because of the investments we are making. Because of the investments we are making. So, these are the things that in the macro discussions, these are some of the important things that we miss. These are some of the important stories that we miss. You know, before the budget, I had said that the Minister of Finance in the 2025 budget would focus heavily on community investment. Because for us, community investment, targeted community investment, is key and critical for quality of life. It's key and critical for the prosperity that we are building to be enjoyed. Prosperity is not only enjoyed in how much money you have in your pocket, disposable income. Prosperity is also enjoyed in the quality of infrastructure you have access to. Prosperity is enjoyed in the quality of services that you have in the community, in the assets that you have within the community to support holistic life, to support efficiency, to support reliability. And what are we doing to advance this? Some of the important issues that were raised include that of sanitation when you go to the community, environmental issue, sanitation, beautification, drainage, security, and community facilities. And all of these we are addressing, we have commenced addressing a number of these, but in Budget 2025, specific resources were set aside. For a matter of fact, subvention to NDCs would increase significantly from $1.8 billion to almost $3 billion. Solid waste, which is an important complaint in communities, would have seen an increase from $1.2 billion to $11.6 billion. Outside of this, we're investing to have community firefighting brigades, volunteer brigades, brigades that will be part of the part-time program. And we have invested in purchasing firefighting equipment, including vehicles and pumps for every NDC, municipality, and town council across the country, so that they would have that capacity and capability. We're investing also in their training. In 2025, we'll be investing in procuring garbage collection, garbage trucks to help us in the collection compressors and compactors within the communities themselves to store and dump the garbage in. And then, of course, landfill facilities in region 2, 3, 4, 5, 6, 9, and 10. Set aside resources to build modern landfill facilities in this region. Outside of that, very soon, we'll commence the implementation of placing street lights in every community across the country, beginning with the urban, with the centers that are important, economic centers. So every single community across the country, every single village, every single region will have street lights installed commencing very soon. This is a health and security program. We have now moved the safe city to safe country with a huge allocation this year. Within the next month, we will go to complete arrangements to have cameras installed across every region, across every NDC, to support our Safe Country initiative. And we have seen how this initiative has helped us in crime detection, crime prevention, and crime prosecution. We are moving now to the digital ticketing system, electronic ticketing system, to aid transparency, aid accountability. And when you look at the transparency index, they took none of this into consideration. That all of this is moving to electronic platform, that we are putting scanners in every single port of entry to remove the human bias and the human element. Everything coming in and going out of the country will pass through the scanners. All of those are additional measures we're investing in to advance transparency and accountability, to remove any human bias. This did not exist 2 years ago, or 3 years ago, or 5 years ago. So if this is new, and it enhances transparency and accountability, but of course, those that are driving the perception, they have an agenda in an election year. They have a motive in an election year, and I'll go through factually these issues. So when you look at what we want to achieve, look at the community facilities, the sanitation facility, the beautification, the drainage, the security, all of this, the healthcare systems at a community level, all of this adds up to give us that quality of life that we speak about. When you look at the waste management system also, we're not sitting back. We are already talking to those with the best technology globally, to bring those technology here to transform our waste into energy, to transform our waste into revenue. At the Eccles landfill site, the first of these facilities and partnership will be executed. We are now working on building more consortiums in Berbice with the private cane farmers, in Region 3 with the private cane farmers, to be part of the agri-diversification plan with our athletes, bringing them, young people and young groups across the country, bringing them into an investment environment, giving them access to land, so that they'll be part of making us self-sufficient in hatching eggs, making us self-sufficient in table eggs, making us self-sufficient in meeting the growing demand for meat. That is where the land is going. That is where the investment and partnership is going. A government that is interested in building partnership with the citizens of this country, building opportunities among all the citizens of this country, advancing those opportunities, and creating an environment in which our citizens would have a significant quality of life. Now let me now turn our attention to something that I've seen in the news today. First of all, let me make it absolutely clear that Transparency International is not an organization that bases its finding on facts. Its finding is based on perception. The important thing is who is driving the perception, who they're using, whose perception they're using. And we'll take a deep dive today to understand whose perception Transparency International is using and the convenience of that perception they're using and the relevance of that perception they're using in an election year. Ha ha! My friends, you will be alarmed to see the level of transparency from Transparency International itself and the body they're using here in driving that perception. Now imagine, I have a graph here. Imagine this. Imagine this, the level of dishonesty with Transparency International here and wherever they send their perception. Imagine in 2020, when you had a government that was illegally occupying office, when you had a government that disregarded a no-confidence motion and ruling of the court, when you had a government that spent more than $600 billion without parliamentary oversight in 2020, when you had a government that refused to give interviews and respond to the media. And look at this. By the way, let me tell you, this entire perception indicator in this report, when you go to read the main report in Transparency International, is linked to what? It's linked to environmental crimes. And when you go here, you see, here's what they say. Although the country has created anti-corruption institutions and laws, transparency and law enforcement are very low. And attacks on dissenting voices, activists, and journalists are increasingly common. Whose perception is this? Let the population be honest. Is attacks on journalists and dissenting voice greater today than in 2020? When they tried to steal an election? When they drove observers out of the country? When they turned up at the counting station and ordered a former prime minister and head of an observer mission out of the building? When they ordered counting agents out of the building? When they did not adhere to the ruling of court and follow court orders? When they refused to adhere to a no confidence motion? But guess what? The transparency perception criminality ranked them higher for that. They got a higher ranking for that. The worst period in the history of our country. They got a higher ranking. I told the Minister of Finance to give you the fact. When you look factually, more persons are ticketed. More persons are, well, I have the figures here. More persons are prosecuted by Kanu. More persons came under disciplinary measures in all government agencies. But you score less. What is this? What nonsense is this? What mischief and misinformation is this? None of this matters. None of this matters. In 2019, look what they say here about processing of information. Processing of information. in 2019, all the permits for development of the Demerara port, tons of permits were withheld by the government. In the first 2 months of this new government, we approved all of those. How can you rank less? How can you rank less? That is the facts. Look, the facts are glaring. The facts are glaring. Let us look at some more facts here, because I want us to address this. Let us look at some more facts. According to the report, the CPI ranks 108 based on perceived, not empirical data. Look at the empirical data. Today, the permits on the APNU, they had an 89% implementation rate in terms of what they process from what they receive. An 89% rate of implementation from what they receive and process. I'm not talking about what is set aside. This government has a 97% implementation rate. In 97% implementation rate, and you score us lower. What more is needed to convince people as to the motive? Look, let's go on. Let's look at the motive. It's important for us to look at the motive. And by the way, the Transparency International that speaks about transparency, accountability, the local chapter here, the last time they filed the annual return at the registry was 2019. The last time they filed their return at the registry was 2019. And let us look, well, we know Enrico Wolford first formed this company. I don't know Enrico, my friend. Are you a friend of the PPP? What is your political motive? Then, what is your political persuasion now? Well, let's come to more recent times and examine who are the directors and who perception is taken, because this misinformation must come to an end. Let us look who are the directors. The president is Fred Collins. Fred Collins. Who is Fred Collins? Fred Collins is one of the persons who filed a legal action against the Environmental Protection Agency of Guyana, and the lawsuit alleged that the EPA had failed to enforce the liability clauses stipulated in permits issued to Esso Exploration and Production Guyana Limited, a subsidiary of Exxon Mobil. Can you imagine that? This is one of the persons who own the company, who filed a lawsuit against the government, against EPA. The question is, what is his perception? What is his motive? Who are the persons he brought on board in the interviews to fuel his perception and motive? Let me tell you what he did. He has criticized the government failure to audit the $9 billion. The $9 billion in cost. This same government who brought in the audit for Exxon expenditure. He criticized us. He didn't say anything about the signing bonus, the 18 million signing bonus. For matter of fact, he allowed them to be scored high. They got a high score for the 18 million signing bonus. We are now doing audit, and they got a high score. for hiding the 18 million signing bonus from the people. That is what perception does. Perception represents a motive and a view designed for a particular purpose. I'm giving you the facts. Let's move on. The second person, the company secretary, Alfred Boulay, is a retired science teacher and environmental advocate. On January 12, 2025, Boulay, along with Elizabeth Dean Hughes, Nigel Hughes, I say Hughes, not say Hughes, I say Hughes particularly here. Nigel, the leader, is he the leader? I'm not. The leader of the AFC, Boulay, along with Elizabeth Danuta Radzik, Vincent Adams. Who is Vincent Adams? Is he a lover of the PPP civic government? He's a permanent critic of the PPP civic government. Nothing is wrong with that. That is his right. The PPP government will always protect the rights of all those who criticize, because between 2015 and 2020 there was silence, muted. But we want them to have that ability, because that is what good governance is about. But you can't then use that ability and claim that you don't have a bias. It is important for us to know who is driving the perception. Who are the players that are involved in driving the perception? So you have Vulcan, George Jaikaran, Karen D'Souza, Frederick Collins, Kushial Collymore, and a few others. And guess what they did? They issued a statement questioning the U.S. Exim Bank's decision to support the GTE project. So these people don't have biases? What do you expect from the perception indicator? Transparency International should answer these questions too, in the interest of transparency. Then we have Dr. Vedawati Ram. Dr. Vedawati Ram. Who is Dr. Vedawati Ram? She's a director. She's a director, okay, of Transparency International. Then we have Director Rishi Thakur. Who is Rishi Thakur? Rishi Thakur is a former member of the AFC, and in 2011 he joined APNU. Oh my, what more you want? These are the persons who the perception indicator is relying on. These are the persons who the perception indicator is relying on. Dr. Thakur, a former AFC member, and in 2011 he joined APNU. Can you imagine if this was a PPP? Can you imagine if this was, one of this director was Ashley Singh under APNU, and a report like this would have came out? They would have crucified him. This is the reality. This is the objectivity of the perception indicator. But let's go to some real agencies and what they have to say. Some agencies that can withstand scrutiny. Let's start. Only recently, the CFATF congratulated Guyana on our efforts in prosecuting. Look at the records, the facts from SOCU. The most cases. So all of these things have improved. But the perception from the people who perceive in an election year, the agenda does not meet. But let us look at some recognized agencies. The UNFCCC, Guyana's commitment to transparency and accountability in the management of climate revenue, has also garnered international acclaim, including recognition from the UN. In 2024, our efforts have resulted in being awarded the Champion of Transparency Award by the UN Framework Convention on Climate Change, being the first developing country in the world and the second country globally to meet its required submission for climate transparency reporting. I can't recall a headline. I can't recall this headline. But this is a UNFCCC, a UN body. Based on facts, not perception, we are willing for Transparency International to bring all of their perceived perception to us so that we can respond to it. I challenge them. I challenge them to bring it. Don't hide under these individuals and persons with a clear motive. Bring it and let's deal with it. Let's look at some other statements. The 2023 IMF Article 5 comments on transparency. Staff commend the authorities' progress to strengthen the management of oil wealth and its fiscal transparency and recommend addressing remaining gaps. We're not hiding. We're not saying all is well. There are gaps. There are issues that we're committed to dealing with, that we're committed to addressing. But we have to address it based on empirical evidence, based on facts, based on analysis, based on identification of the weaknesses. We want to address it. Guyana continues to strengthen its AMLC, and this is the IMF report I'm continuing to read. CFT framework. Guyana is undergoing its fourth round of mutual evaluation, which focuses on technical compliance and effective implementation of FATF's 40 recommendation. Guyana has approved a national policy and strategy for combating money laundering, terrorism, financing, which addresses the risk in its 2021 National Risk Assessment. In 2022, Guyana went through its third EITI validation process for the year 2019. We're not hiding from assessment. Every single international assessment, we are subjecting ourselves to. Every assessment that is based on facts, we are subjecting ourselves to. Furthermore, to ensure full transparency and accountability, notification of receipts of petroleum revenue has been published in the official gazette since April 2022. These are things that we implemented. How can your score go down with these things? The anti-corruption framework is being strengthened. The Integrity Commission operationalized and resource reflected in the 2023 budget. Imagine they never submitted their returns to the Integrity Commission and they got high score for that. We supply, we submit. But the perception and the drivers of the perception. In December 2024, the Caribbean Development Dynamics 2025 by the Inter-American Development Bank reports highlights Guyana's significant progress, noting that the country's commitment to strengthening democratic processes through transparency is a powerful tool for building public trust. The report notes that Guyana meets the necessary criteria regarding fiscal transparency, access to information. This is what they say. They say that we attack dissenting voice and activists and journalism. This is what the report says. Guyana meets the necessary criteria regarding fiscal transparency, access to information, disclosure of public official assets, and citizens' engagement, and are thus considered eligible for OGP membership. This is the reality. So, my friends, I have a duty to bring these facts to you. And before I close, let me say on the Mucka Arcadia squatters issue, we are a humane government. We don't see PNC, APNU, whatever form the AFC, PNC, AFC, whatever form they have. We see every single citizen as a responsibility of the PPP civic government. And that is why we offered all those who are squatting in Mucka an opportunity. One that was fair. The few who are misled by Norton, the few who are misled by Norton and the PNC and the AFC, yes, the court has ruled. But we are a government for the people. We are a government that will embrace the people every single time. And whilst they stay silent on you, your president is ready to receive you. Your president is always ready to work with you. Your government, the People's Progressive Party civic government, has an open door and open policy to make the life of every Guyanese better, including yours. But I'm happy you had the opportunity to see who cared for you and who wanted to use you, who saw you as pawns. It is unfortunate and sad that such political entity and individuals exist. But know that you have a friend in us. Know that you have in us a government that cares. I saw some disgusting narrative used to describe Afro-Guyanese. And what an injustice coming from people who inherit the party of Walter Rodney, a nationalist, a true Guyanese, a patriot, a man who fought for every Guyanese. He did not see race or ethnicity. But after all, they're in bed with the plotters of his death. What more can you expect? What more can you expect? But these sentiments that were expressed by David Hines would never find its way in the media. The media would never be outraged at this. The social commentators and transparency experts would never be outraged at this, because this does not fit their agenda of outrage. Their agenda of outrage is only about the PPP. And they have made it very clear that their only motive and interest is to bring together every force that would help them in their unachievable idea of removing the PPPC from government. It is unachievable because our achievements speak for itself, and the people are aware of our achievements. And together, we the people will build a stronger Guyana, stronger together, under the People's Progressive Party civic government. I thank you, and God bless you, and I really appreciate the time you have shared with me this afternoon. Thank you.